Up next, another story not to be missed.
Spine pain isn't just a physical ailment. It's a daily struggle that affects every aspect of your life. Understanding and addressing spine pain is crucial, not just for your body, but for reclaiming your quality of life.
About 30% of the people, the general population, have back pain at one point in their life at least. Spine pain can affect numerous patients, typically around the late 30s, early 40s, and it's where the back quote gives out. It's typically the pain from the joints in your back. One of the most common causes of spine pain is disc herniations, where the disc blows out. Then you have the leg pain. Another very common cause of back pain and leg pain is spinal stenosis. Also, the arthritis sets in the facet joints, so you can also get arthritic back when your back goes out. Some people are born with a tight spinal canal, and that's the stenosis, so it makes you more prone to have back problems. Another one is like a disc herniation. So if you blow a disc herniation, like if you squeeze out toothpaste, that disc squirts out and never squirts back in. So disc herniation is very, very common.
So, what can a patient expect, and what are their next steps? Dr. Stephen P. Courtney from Advanced Spine Center is here to explain it all.
The treatment the patient should learn first is what causes your pain. And that's really helpful to diagnose a lumbar x-ray or a spine x-ray. And also number two is an MRI scan. I go to great lengths to tell those patients what their problem is, and very frank and straight up about it. And that's very vital to how to treat the patient. So you have to understand what your diagnosis is.
Innovative ideas are revolutionizing spine surgery, leading to significantly better outcomes for patients.
One of the biggest cutting edges in spine pain right now is the 3D printed technology. So that's a titanium powder ran through lasers, and then we can build different products and different matrices for that. But 3D titanium printing technology is by far the number one new technology in spine. The beauty about 3D printing technology is you can actually design and dial in the matrix that mimics bone. So if you're trying to achieve a bone fusion, if you develop that implant with the mindset that that's the trabeculae or the bone itself, the bone would want to go that device better than it would a different device. So you can dial in the 3D technology lattice, if you will, so you get a better higher fusion rate and you get better clinical outcome.
Most recently, Dr. Courtney has developed his own line of FDA-approved surgical tools, Eminent Spine.
I think I can make implants better with the tools that are on the market. As we get better as surgeons, you see there's room for improvement, and I was able to take that on and improve the implants and also improve. Number two is the instrumentation goes along with that. And I can design implants a lot better and smoother, a lot more effective than the typical company can. They're thinner, they're more streamlined, they're more state-of-the-art. It helps decrease your infection rate. They're just a cleaner implant, and it's just a clean system to make, and I've done a very good job of doing that. Also with the instrumentation, the tools that go with it, very important too. You have to have the toolbox. We have to design the implant on the computer, then we have to get it made for testing, then we go test it. We submit that information to the FDA, and then that can take up to 3 to 6 months if you get lucky. So that probably can take up to about a year just to get the approval process to make the implants, to mass produce them.
I was a gymnast for my entire life. I fractured my back, training 36 hours a week throughout my entire career. Before college, it was a lot of tumbling, a lot of practice, all those kinds of things. And after a while, I realized it was hurting too bad to even move, walk, like getting out of my car was tough. Dr. Courtney took more of a conservative approach, and he was incredible. He was the one that I would actually listen to, and he helped me get through all 4 years of gymnastics with no pain.
Dr. Courtney, the experience I have had with him is remarkable. The man is thorough. The man is telling you exactly what's going to happen. He doesn't sugarcoat anything. He tells you how the operation's going to go, the healing process, what he expects you to do after the surgeries, and then after that, it's up to you to follow his recommendations. Thank you, Dr. Courtney, for everything you did for me. You saved my life.
Future plan is to keep doing what I'm doing, evolving Eminent Spine, keep evolving Eminent Medical Center, keep evolving instrumentation and implants, and providing, in my opinion, a great hospital experience for patients, because it gets overwhelming at times. So I'm going to keep expanding the hospital as well.
To learn more about Advanced Spine Center, visit advancedspinecenters.com or see this segment again on thebalancingAct.com.